We are with Hillenbrand Inc. My name is Julie Yeager. I'm the Director of HR Global Services. We've had On Target Health for a little over 5 years.
Okay, I'm Yasmin Van. I have been with Hillenbrand for 4 years. I'm the Manager of Health and Welfare, so I'm responsible for all things health and welfare, including this program, On Target Health.
I remember talking to my boss one day and I said, we're going to have to offer this program or, they're going to be rioting in the streets.
I think that it's been a good thing, and I think that we get a lot of feedback from associates, right? It's not one of the programs that people are scared to talk about.
The impact of the On Target Health program has been wonderful for our company, and it's impacted us in many different ways. One of the ways is actually the health of our associates. By removing fatty tissue, it makes a person healthier. So what this does, it takes people off of medication, so we have true cost savings, hard cost savings with medication, as well as the change in health state. So our future health state of our employees is a better one for the program. It also has changed the outlook on employees. When you think about weight and their health in that manner, it's very much a physical thing. People have a different viewpoint when they see themselves in the mirror. They feel better about themselves than what they did before, which changes their state of mind. This then, of course, increases our engagement. We also have had a change in our culture as this has happened with the things that we eat. People are very much more conscious about their eating habits. They talk to one another a lot about what they eat for lunch, what their snacks are. And it's interesting when you have a program like this, because you're usually pushing things out to people. But in this program, people want in. So if people are asking and it's making a change in their life, then you want to sign up for it.
We do a lot of communicating internally.
I think my favorite one is the big bod pod.
Oh, we have the
Big
boards.
bod pod boards.
boards.
When we first started, we put those out, and of course people didn't know what they were, and we put signs on it's coming and all kinds of fun stuff. So that's my favorite one.
Yeah, people
is
like
the big
that.
bod pods.
People
It's,
like
you know,
that.
it's kind of cool
intriguing.
looking.
Recently, we did a 6,000-pound celebration, right? We actually did that here at corporate. It was a really good event, and it was more of an event to say thank you to everybody that's participated, and also give people a chance who are either new to the company or just haven't tried the program but is thinking about it to come learn more about it.
You know, we've had people that have made some really big changes, and they talk about changes with themselves and their personal, their personal awareness, and how it also has even changed personal relationships with their family members. One of the things that I had seen with this program that has helped too is that if we can get an employee engaged and then we can get their spouse engaged, they're probably feeding their children better too. Mm-hmm. There are things that this program can offer that's hard to calculate. One is around engagement. I feel that we have employees that are healthier and happier in our workforce because of the program, and that makes them better workers, right? I think another thing is around absenteeism. Some people don't track it. With our salaried workforce, we really don't track it. But I know the first year when we were looking at this type of thing, we felt that we had great improvement in that. So that's hard to put a number to. So it's not just about hard cost, but it's also about changing your future claim cost with your health care.
Yep, I would definitely recommend On Target Health to other companies. Me being in my role and my seat, I would say make sure you have some understanding of what your associates want, so you can communicate to them in the best manner, right? We try to make things easy, kind of remove the barriers, so people can just go in, get there to their appointment. There's no paperwork or anything like that, right? So any way that you can make it easy, I think that makes for a good implementation.